First, lithium. Abstain anomaly. Fetal goiter.
Second,
Valproate. Spina bifida, limb defects. Autism spectrum disorder. Facial and cardiac anomalies, coarctation of the aorta, aortic stenosis, pulmonary atresia, ventricular septal defect. Third, vitamin D. Supravalvular aortic stenosis.
fourth,
Warfarin. Fetal bleeding. Hypoplastic nasal structures.
fifth,
Statins. Vactral. Vertebral, anal, cardiac, tracheoesophageal fistula, renal, arterial, limb defects. Sixth, phenytoin. Hypoplastic phalanges. Cleft lip, cleft palate, microcephaly, ventricular septal defect, atrial septal defect, coarctation of the aorta, patent ductus arteriosus. Seventh, penicillamine, cutis laxus syndrome.
eighth,
Isotretinoin, craniofacial anomalies, heart disease, CNS anomalies.
ninth,
Progesterone, masculinization of the female fetus. 10th, quinine, abortion, thrombocytopenia, deafness. 11th, topiramate, cleft lip.
12th,
ACE inhibitors and ARBs, hypoplasia of organs, anuria, irreversible renal failure. 13th, carbimazole and methimazole, choanal atresia, aplasia cutis, tracheoesophageal fistula, and fetal goiter. 14th, alcohol, low IQ baby, fetal alcohol syndrome, atrial septal defect, ventricular septal defect. 15th, thalidomide, phocomelia, multiple defects of internal organs.
16th,
Methotrexate, cleft palate, hydrocephalus, multiple defects, fetal death. 17th, stilbostrol, vaginal carcinoma in teenage female offspring. 18th, tetracyclines, discolored and deformed teeth, retarded bone growth. 19th, carbamazepine, neural tube defects, assorted abnormalities. 20th, indomethacin/aspirin, premature closure of ductus arteriosus.